It's a pleasure to have both Dr. Johnson and Melissa back with us today. First of all, just how important is child vision? And what I mean by that specifically, how important is it to have vision problems diagnosed very early in life?
We see a lot of people that have come in, and I think that in many cases their ability to advance themselves, whether it be a vision problem or misdiagnosed as ADHD, have definitely told us they've been held back. Sometimes just their appearance, if they have a crossed eye, I think sometimes makes people think that they're not intelligent, as crazy as that may sound. And sometimes we detect that based on symptoms, and they don't even know that they have it. And I'm not talking about if it's visually obvious, but it's something that we may measure and let them know, and they think they're dyslexic, and they aren't seeing with both eyes together. And so it very much can, based on those things and lack of having an eye health examination, and in that determining whether or not there is a need for a prescription to help them see better to function on their job, since we are so electronic device intensive, reading intensive. It is all taken in, all that absorbed through our visual sense.
And Dr. Johnson, just in raw numbers, how many elementary age children are we talking about that have vision problems?
Believe it or not, if there's 300 million people in this country plus, there are more than 5 million elementary age children who have vision problems.
And then when we're talking about the percentage of children that receive eye exams before entering school, are we talking about a big percentage or a low percentage of children that receive that all-important eye exam before entering school?
Hear from a lot of parents, they'll come in and get their eyes examined. Well, I guess I need to bring my son or my daughter in, but they see great. They haven't had any problems, or they had one of those, they had their eye test at school, and their eye test at school was reading a chart, and that doesn't really detect much at all. So only about 1 in 3 children receive an eye exam before entering school, and that's not even every year.
And I know that we may not realize this as adults, but when it comes to kids, do kids many times realize that they have vision problems themselves?
Well, in a lot of cases, they may notice that they cannot see as well. Sometimes they're afraid to tell their parents because they may not want to wear glasses, or they may think something's wrong with them. They don't know, and sometimes they just can't communicate that. And like I said, it could be fear, and it could be that their parents that they don't like, should they be determined that they need glasses. And yet it's kind of funny, some will do anything to get a pair of glasses, and we have to examine them very carefully, and many times have the parent just step out of the room a second so we can kind of get some good, honest information, because we don't want people wearing, or anybody, but kids to be wearing glasses that they don't need, and that they may not be appropriate for certain distances to be worn all the time. And then the teacher doesn't know that, and the parent may have forgotten that, or the kid may not be around the parent when they are needing to use their glasses. Parent's not there to tell the teacher or to tell the kid. So that can make their vision get worse if they're not worn appropriately, if they need prescription. But we're always we don't want people to get glasses if they don't need glasses. And we're really trying to help kids keep from getting worse. So we're taking a proactive approach. And that way, when you go back to your statistic of 33% of children, in this country are actually receiving an eye exam before they enter school, there's a whole lot of kids, and just in talking with them, it's important that not only their parents know this, and that an eye chart's not sufficient, a whole eye exam to evaluate their eye muscle alignment and their internal eye health, as well as their potential need for prescription, is so important for them to do well in school and not be labeled as a dumb kid, okay?
Or ADHD.
Yeah, or ADHD, like Melissa's saying here. And it'd be because they can't see. And a big thing that I think parents need to think about is that kids are now almost born looking at a phone, you know, and our electronic devices are also causing visual damage to eye health, which parents, again, if they're thinking is, and that's just not for their children, it's even for themselves. They think, if I'm seeing fine, I don't need to get my eyes examined. I think we've discussed in other interviews that, and not trying to ostracize anybody, but just to give a parallel is that, you know, they brush their teeth every day, and they don't necessarily hurt. That's not why they're brushing their teeth, but they're waiting until they can't see, or they think when I can't see, I'll come see, and they tell me that socially all the time. So it's not something you can really address socially because you're not trying to preach.
But we see a lot of adults that, you know, have not noticed changes in their vision because, you know, the eyes tend to adapt, and the stronger eye has a tendency to take over when they're having a hard time. So children certainly don't always know when their vision has been changing, because we have adults all the time that don't know that their vision has changed. And like Dr. Johnson was saying, it's so important to have a yearly eye health exam, even if the prescription hasn't changed, because we can catch, you know, issues that can create vision loss that may not be detected. They may not affect the prescription until there is actual vision loss, and when at that point it's too late to reverse.
And now we're in summer, and why is summer a really good time for parents to take their kids in for eye exams?
Well, the kids are out of school for one thing, and, you know, typically families have some more time to do things like this. That, you know, you don't have to have all the after 4 p.m. appointments because the kids are all in school, and it's just a good time to get them used to wearing their glasses if they do need glasses before school starts back in, get them into good habits before they go back to school and start their regular, you know, everyday routine. And it's also just a good time for parents to talk about it with other parents, you know, at play dates and sports activities. Just to remind all the parents, we're all, you know, they say it takes a village. We all need to remind each other to have our kids' eyes examined as well as our own.
Yeah, we always encourage when parents or just anybody's in here, and we don't know a lot of times if they have kids or they have friends with kids, but we always defer to the electronic devices in which they're thinking that even if their vision's great or they don't need an eye exam because they hadn't, and they're convinced that test at school has told them that everything's fine, that there is damage, like Melissa's saying, potentially, and talking around with other parents, and the ability for them to be out of school is a good time. It's a little bit more relaxed time, that they have time to maybe focus on, I know, the fun things they want to do, but it's important that we let everybody know what they're with our kids is that their electronic devices they're growing up with are really potentially causing them to need glasses and also causing damage. And so whenever we mention this in exam room, the parents are always like, I know, listen, Johnny, you stay on that. You stay on that phone all the time, or you don't get off that computer. So I told him about that, and he's watching too much television. But, you know, we're not going to change the way we work and live. Everything's electronic, visual, and kind of a sensory input these days. So the best thing that you can do is to be preventive and to catch things early, as Melissa's just said, and not think that vision equals whether or not Johnny can see 20/20, that knowing that there's elements out there that could be causing them to be slowly developing a visual health problem and or a potential need for glasses that could have been arrested at an early stage. There's so many adults we know have come in here that are, it's usually nearsightedness, that are very nearsighted, and when we ask them when they were children about getting their eyes examined and they didn't, or by the time they were in the 4th grade, a lot of people will tell us, I started wearing glasses, and they've gotten so terribly nearsighted that we know had they been caught early and not maybe be prescribed nearsighted correction, that maybe it's the reading that's contributing to their eye visual strain. Well, that's the same thing if they're on a phone or an iPad or that causes the damage, but can make them over-focus, and we can use different types of lenses that can relax their eye muscles so the visual system doesn't end up becoming nearsighted.
Parents are a little nervous about their children in a bifocal. Sometimes people have the preconception that it's for older people, and grandma wore the bifocals, but it's really kind of training the children's eyes so that typically over a few years of them wearing the bifocals, they may not need it anymore after a certain time because it's kind of trained their eyes to relax at a near and focus at a distance. So it's something that parents aren't necessarily used to, but I think when we explain it, they understand why it's a useful tool for their kids.
And if there's any confusion on that discussion there in terms of what Melissa's talking about, a bifocal is sometimes recommended when a child comes in and they're barely needing a prescription. The bifocal helps relax their eyes to magnify a reading print or make it easier for them to see their electronic devices, and that, like she said, is potentially helping them from becoming needing glasses full time. We always say it's kind of like braces on your teeth. We're hoping this is going to keep you from getting worse, and maybe after just a few years you won't need to wear any glasses. But that's not always the way that we'll take care of a child when they come in, is a bifocal. But if we want them to be able to see distance and near, it just depends on what we find their prescription or eye health to be in determining what type of lenses, whether it's for reading only or distance only or a combination of looking off at a distance and reading. It just depends on the child and the situation and what we discuss with the parents, what we think that they would wear. And we don't want anybody getting something, if they do need glasses, that they're not going to use. There's nothing worse for a parent to be out some expense and the kids hidden the glasses.
Or throwing them in the backpack.
Yeah, hide them in the backpack, or said they lost them. Maybe they did, maybe they didn't. Maybe they wanted to, and maybe they made them. But, so that's just, those are some ways that we go about that. And that really does take explaining to a parent, because if they're just thinking the eye test, and we hear this all the time. We support a lot of different charities, and we sponsor different. We go to do vision screenings at schools. We have, and then we also sponsor some of the sports groups in Memphis. And when we have like an eye chart out there, that's all they want to do, and they don't know the rest. And we have to give them a pamphlet that explains that. Even so, they don't quite get it. And again, if we have the opportunity once they get an exam, we try to show them the images of the back of their eye they can see, and show them how all of the corrective devices work together to allow their vision to continue to work. And if any of those components in their eye health are slowly deteriorating, no glasses are going to continue to help them see. So that's not something people think about or know until they actually come into our office.
How can our listeners take advantage of the free vision screenings at Eyewear Gallery?
Well, we have the free vision screenings every Friday between 2 and 4, and they can give us a call at 901-763-2020, and we can get them scheduled. And that's for kids particularly, but it's also for anybody who's interested in getting a free vision screening.
And very importantly, where is Eyewear Gallery physically located, and what about the website and the phone number? Okay,
we are located at 428 Perkins Extended, near the corner of Perkins Extended and Poplar. Our website is www.eyeweargallery.com, and the telephone number is 901-763-2020.
And before we go, is there anything that either of you would like to add about National Child Vision Awareness Month?
Our National Association, the American Optometric Association, kind of designates a given month in the 12 months of the calendar year to particular eye disorders that are most prevalent in the population. So they designate Child Vision Awareness Month during this month of June because, like Melissa said, the kids are out of school, and to make parents aware this is a good time to go ahead and do this before we get in the rat race routine of starting school, where they've gotten the first month's grades back and they haven't done well, and they don't know if they're just being lazy and maybe not thinking about vision. So that's why we try to make people aware this is a good time of year and that's why obviously our National Association, the AOA, has designated the month of June to Child Vision Awareness Month.
Thank you so much for being with us yet again. We've been speaking with Melissa Moore and Dr. Warren Johnson. One spells that first name Warren, and Dr. Johnson is a medical optometrist with Eyewear Gallery here in Memphis. This is Eye on Vision.